Well, good morning, ladies and gentlemen. Can I firstly say thank you very much for inviting me to be here this morning. As has just been described, this is a really wicked, tricky problem that we face as a community, as a country, as a financial institution, if you like, because there's talent, capability, and huge amounts of untapped resource out there that is not fulfilling its ambition in life and as part of our society because there are parts of our system that are cracked. And if we all kind of get our heads around the fact that the system isn't working well, and it's certainly not working well around mental health, then our role today has got to be to understand where those cracks are, and then see what we as partnerships and stakeholders can actually do to change that landscape for the better, so that we can make the most of our young people, we can reduce the prison population. And my absolute agreement that the only way that we're going to deal with this is to start to turn that tap off. We all know that crisis end services are the most expensive. How could we possibly imagine that that's a sustainable position? And I'll start to give you some facts and figures in a minute about the policing perspective. But I do think there's also the financial implication for us as a successful country, that we are missing the opportunity to exploit the talent that's out there because people are falling through the cracks in mental health care and becoming ill at a point in their lives where their development is really important and their potential is lost. So it's not just about what each of us does to an individual and for an individual when they have a health need. It's also about what they're able to give back to the country as a result of being well, being competent, being confident, and being treated. So it actually, you know, this is a big, big jigsaw for us. Since I've been involved with mental health departments and their comments around safety, I thought most interestingly was their comment around the fact that there appears to be a real significant tipping point now between the role of accident and emergency and social care commissioning services. It's fairly obvious, isn't it, that if social care commission services are being reduced, and that would include mental outreach services, it would include drug and alcohol services, it would also include AMP services and so on linked to mental health, you will increase the number of people who are presenting at A&E that should be being treated elsewhere. So there are cracks across the entire system. There's been a 20% rise this year in the use of Section 136 by the police. I think that also masks the number of people who are in cells who are later diagnosed as needing a mental health assessment and potentially mental health care and sectioning. And the pathway for those people, frankly, is way below where it should be. People are often detained in police cells for hours waiting for a bed to become available, a place of safety to take them to. I don't see that that is the fault of health partners. I think the problem in the system is much more about understanding and comprehending the demand before the services are commissioned, or having points along the spine of a commissioned service where somebody is held to account for the quality and quantity and capacity of that service that's being delivered. And I think that's something that we all play a part in. I don't think it's fair to expect any part of the public sector to know the whole picture. But together with our voluntary sector partners, actually we can be pretty sophisticated about comprehending not only the demand that's in front of us, but the demand that's coming. I think it's really interesting that drugs were mentioned earlier on. I think there's a whole issue around legal highs and the implications that is having on psychosis. And if any of you saw the documentary earlier on in the week about a particular drug that homeless people are now taking, which absolutely, completely turns them catatonic as a result of the strength of this drug, God only knows what the long-term implications on their brain and neural system is as a result of that type of strength of drug. So there are things that we can see that are coming that are going to increase demand. I actually think our problem is we don't properly analyse the demand that's in front of us already. So if we go back to the policing numbers, 28,000 people needing places of safety. I wish I could stand here and say that every single one of those 28,000 people was seen within an hour, was given an effective treatment, was either detained or not detained appropriately, had a home care plan of some sort or an intervention plan suitable to the level of treatment that they need, and more importantly, a community psychiatric team that was resourced sufficiently to manage a caseload that's growing by the day. And I think those are the things that anybody in the health environment and health professional environment would say are their biggest challenges. People with significant mental ill health and sometimes challenging and potentially dangerous mental ill health are being placed out into community and community care on the basis that there is such a tremendous pressure on mental health beds, on places of safety and so on. There was a documentary last year, I don't know if you saw, a very eminent CEO from a mental health trust describing how her staff had to make the decision as to who was the least ill in order to release a bed, not who didn't need treatment. And I think all of these things add up to the fact that we have a thoroughly undiagnosed demand on the services that reach all the way from young children who are being bullied at school, who will potentially become offenders, offended against, victims, dependent on drugs, alcohol, potentially victims at home, all the way through to those who are, I guess, so damaged mentally, either through established mental ill health issues or life experience, that they cannot function effectively in society and will constantly be demanding either crisis or pre-crisis services from the NHS and from various providers. So in order to turn the tap off, we've got to understand what's in front of us, but we've also got to be thinking ahead as to what is likely to be next. I have no idea what the mental health crisis demand is going to be as a result of online sexual exploitation. I don't know anybody who does, but it seems fairly obvious to me that there will be victims of that type of abuse who will become depressed, who may well enter into the criminal justice process, whose lives may no longer be as functional as they were. And yet there is nothing to pick people up at the point of becoming a victim that puts them into the right psycho-supportive services to prevent them from deteriorating, to get them into help at the first possible opportunity. And we know from the policing perspective how often we come across people who are not bad, who are not mad, but who need support. And there are plenty of statistics out there, we hear them all the time. 1 in 4 of the population will suffer from a mental ill health issue at some point in their lives. And it could be anything from depression through to a quite serious psychotic illness. Well, it's a normal part of life. So why is it not a normal part of health and social care provision? You'll hear from Geraldine Strathdy later on this afternoon. And the National Health Service describe care quantity as a burden of care. It's not my words. The burden of care around mental health is around about 25% of NHS business. And as far as I know, they get less than 7% of the budget. So there is disparity before we even start. And I think it's much more difficult to maintain that disparity faced with the evidence that I think our commissioning groups should be in possession of, that enables them, A, to set the strategic priorities for that area, but also to look at what are the developing needs of that area, which may be different. And my personal view is that the Joint Strategic Health Needs Analysis process is perhaps not as sophisticated in terms of the data search that it uses that it might need to be in the future. There is going to be no more money. There is going to be less money. In that environment, unless we are really clear about where our demands are and where therefore our priorities must be, we will continue to have the sticking plaster of police officers and ambulance services picking up people who have got to the point where they are so in crisis that they are now in emergency. There is little in the way of walk-in mental health support services. There is little in the way of services that are available to young people in schools. There's very little in the way of mentoring and coaching for those who are developing within the school environment, who are at that point their most malleable, their most receptive, and probably their most recoverable. So there's 2 ends to this for me. There's the children and young person end, which is hugely important. We know the impact on a child between the ages of 5 and 10 are those that last the rest of their lifetime. But the damage that can be caused by entry into the criminal justice system below the age of 14 generally tends to mean that somebody is going to be entering the justice process way into their 30s and 40s. And I have absolutely no doubt that there is a huge overrepresentation within that community from black and minority ethnic, predominantly young people and young men. If we look at the impacts, for example, on gang activity and gang affiliation, the number of young men who are abused, sexually exploited, assaulted, injured, who are part of a gang, and it is the gang itself that actually inflicts those injuries and that damage on that young person. They're living in fear, they have no way out, and inevitably they suffer from mental ill health issues as a result, and almost predictably will come into contact with the criminal justice process. All of those things are predictable at an early stage. Many of my colleagues who work in teaching environment will tell me they can spot the children who are going to end up in the criminal justice process probably around about the age of 7. So what are we doing about that? Because very often they're from challenged and damaged home environments. They may be subject to parents who are alcohol or drug dependent, suffering from mental ill health. All of the upstream intervention points that we are hopefully going to discuss today are those very points that change the life of somebody's future. They change the course of either an offending career or a victim career. And I think the police do have a huge role to play in this for a number of reasons, not the least of which is that at the moment we are that first point of contact for somebody who's in crisis. And if officers don't know how to respond in an empathic and understanding way, then the whole crisis issue escalates. It's pretty obvious to me that somebody who's in crisis is going to be frightened, but their behaviours may well be very aggressive, may well be very challenging. But you get to that point from an earlier point, and my worry is that far too often we only come across people in that condition because there has been no previous intervention or opportunity or seeking of help for any number of reasons, many of which have been mentioned this morning: stigma, fear, embarrassment, community isolation, a whole range of things that mean that people do not, A, identify with their own mental ill health issue, or B, seek help for it. So inevitably they're going to come into the vision of the police, particularly when members of the public call us because somebody is behaving in a strange, unpredictable or odd manner. But I'm much more confident now than I was 3 years ago because of the training that we've done with our officers, because of the way that our officers have responded to understanding what mental health is about and how prevalent it is, even among our own ranks, and I'm sure among your own. You know, we talk about how we deliver services to others, but frankly, the way we deliver services to our own staff is as important. But I'm really pleased with the work that my teams have done, and I have to say, I am not the expert. The expert are my staff, the people that I've worked with in the health service, service users, and everybody else who's had the time and the inclination to support some really tricky work around what the police role is, for example, in restraint in the mental health environment. What is the police role in terms of dealing with somebody who appears to be vulnerable, and how can we refer that person on to the appropriate service? And that kind of brings me to my final point, which is, how do we share information effectively? A lot of the time we come across people who are clearly not well. Do they meet that threshold of being so in need of care and control that they need to be removed to a place of safety? Well, that's an officer's discretion. But I feel certain that if we were more able to make a judgment at that point based on some knowledge delivered by a professional, and by that I mean being able to talk to somebody who says, yes, we know John Smith, yes, they've got a local community psychiatric team who's looking after them, their lead social worker or their lead mental health liaison officer is such and such a person, and actually John's behaviour is fairly normal. He's been to see us in the last few days. We'll make sure that somebody gets to see him this afternoon. That's one person who, A, wouldn't need to go in through the doors of a place of safety, who probably wouldn't be sectioned anyway, but the officers would have felt that they've done their job because there was no other option than to arrest them and take them to a place of safety. And I think that's the other piece, is we need to start to think about the options for a more efficient process between professionals, for a way that we can properly exchange information at the right time and the right place to make the right decision. and thereby remove the demand on some of the crisis care services that we know are under so much pressure and are doing such a fantastic job across the country to try and meet the demand that has been under-resourced, has been under-commissioned and has been misunderstood for far too long. Thank you very much indeed.